Essure is a sterilization coil. It's inserted into the fallopian tubes. It's meant to scar and close them. It's owned by Bayer, based in Germany, and received FDA approval in 2002. Since then, a growing number of women who found each other first on Facebook have been cataloging unplanned pregnancies, autoimmune disease, and organ perforation. This spring, that social media movement took the women face to face with Bayer in Germany.
Michelle Garcia and Angela Deza took the hopes of almost 10,000 American women to Germany last month to address the stockholders of Bayer, the new owners of the Essure device. Michelle delivered a 30-minute speech in German. She doesn't speak German.
For whatever reason, they say speeches in German only. And I thank God I was prepared.
Michelle hired a German language coach and trained 2 hours a night for 2 weeks to deliver the speech with the confidence she says she owed the other E-sisters.
I stood up there confidently, comfortably. I wasn't even nervous, and I thought I would be. But I know my story. I know the story of all the thousands of women who are injured, and Bayer was not stealing my voice. They stole enough from me.
We're responsible women who decided that we were done building our family, and we're being punished for that.
When we met this group of local Essure patients last year, there were 3,000 on the Facebook support site. That number has since swelled to almost 10,000 members. One of them is Gabriela Avina, a gynecological nurse who participated in Essure surgeries for clinical trials. She decided to get the device herself in 2000. Members of the online group found her last spring.
I ignored them at first, and I ignored them for several months and several attempts until I finally got a message from one of them saying, "I know you don't want to talk to us, that's obvious, but will you just tell us if you're well?" And then I was intrigued.
Gabby wasn't well.
I've had a total of 5 different autoimmune diagnoses in the span of 12 years.
As a nurse, Gabby had spoken on behalf of the developer of Essure, Conceptus. She was all over the literature and videos touting the device. She spoke at national conferences, even ran an online forum for the company to answer questions about Essure. During the Food and Drug Administration hearings, her testimony helped Conceptus get the coveted pre-market approval, which gives the makers of Essure a legal shield. A PMA makes it very difficult to sue a company over a medical device.
I watched the procedure several times. I participated in it. And so then I decided this is what I need. This is a great option for me. And I had it.
She didn't connect her illness to the device because it was doing what it was supposed to do to keep her from getting pregnant.
That is post-chemotherapy. And I had no idea. Here I was advertising for this company. It's actually been 14 years since I had the device. I've had lots of medications. I've had chemotherapy. I've had depression.
Gabby also now has the other E-sisters, as they call themselves, women who have gathered online to catalog their unintended pregnancies, injuries, illness, and psychological stress.
I really lost my identity. I wasn't able to parent like I wanted to. I wasn't able to be a wife like I wanted to be. I wasn't able to be a nurse.
Although they support each other online, and despite the trip to Germany to speak to Bayer stockholders, the women hold little hope that Bayer or the FDA will step in to investigate their claims.
Unless it hits them in their pocket, they're not going to react because they have a product on the market and they're going to encourage doctors to keep pushing it.
A lawsuit just filed against Bayer in Philadelphia is the first attempt to pierce the pre-market approval status of Essure by claiming the company never followed up on the conditions of the approval. We reached out to Bayer for comment, and we got the following statement. Patient safety is very important to us, and we have great sympathy for anyone experiencing pain, regardless of the cause. These stories, while compelling, are not representative of the hundreds of thousands of women who have relied on Essure since its FDA approval in 2002. Now, if you go online, I've posted the entire statement from Bayer and the lawsuit filed in Philadelphia, as well as other links about Essure.